really my goal in my position and within our department is to look at different ways that we can engage in sharing information, knowledge, resources, and help empower people as they're trying to make decisions for themselves and their families. And I think that is just such a wonderful opportunity to be a part of.
Welcome to the James Cancer-Free World podcast. I'm Steve Wartenberg, and our guests are Julie DeBord, the manager of JamesCare for Life, and Denise Schimming, a James nurse practitioner and survivorship specialist. Due to the steady leaps forward in cancer research and treatment here at the James and around the world, more and more people are being cured and are living longer after their cancer diagnoses. Survivorship is a fast-growing and important component of comprehensive cancer care, and the James has one of the biggest and best programs anywhere. Julie and Denise will fill us in on what they and their colleagues do to improve the quality of life for cancer patients and their caregivers. Thanks for joining us on the podcast.
Great. Thank you, Steve, for having us here.
Yeah, I'm excited because this survivorship is a growing field. It's a somewhat new, but not really new area, and you two are experts. So I thought we would start, if you could each kind of, Julie, you're more from a providing program area, and Denise, you're more from a clinical side of things. Just give us a sense of what survivorship is, what it means.
Sure.
I'll take that, Julie.
Oh, Denise, all right. Denise, you'll start.
Yeah.
Okay.
So really, survivorship's a term that's been around for some time now, but it's really evolved over the years. And here at the James, we've kind of diagnosed or kind of decided that survivorship is an individual who is diagnosed with cancer from the day and throughout their lifespan. And we know that in that definition, it impacts not only the patient, but caregivers and their family members as well.
So from the day you're diagnosed,
throughout your
the rest of your life, you're a survivor.
You're a survivor, yes.
Okay. Julie, would you like to add to that?
Sure. As we think about cancer survivors, we are looking at anyone who's diagnosed with cancer, and we're also focusing on their caregivers as well, anyone in their family.
Yeah, that concept of including the caregivers is important because we've said this a few times on the podcast. They're sort of the unsung heroes of the cancer journey.
Absolutely.
So as survivorship has grown and more people are living longer with cancer, more and more programs have been developed. So why don't you walk us through the programs that are offered through JamesCare for Life, and Denise, how you work with patients in your own programs and connecting them with JamesCare for Life programs.
Yeah. Well, I'll start. I would just say we have been around the survivorship program about 10 plus years here at the James. So we were seeing patients, treating them for cancer, but really figuring out that they had additional needs that we weren't addressing very well.
Because back 30, 40 years ago, there were no programs because people didn't really live long.
Yeah, people are living longer. There's earlier detection. There's better treatment, clinical trials, genetic testing. So there's just a lot of factors that have shown us that people are living longer with cancer, and how do we make sure they have the best quality of life throughout their cancer and then years beyond. So this clinic was really established for that, and what we provide in this clinic is supportive care services for the patients. So when I started 10 years ago, we would see a patient, talk to them about their cancer, maybe set them up with some counseling services that we had, talk about maybe some art or music therapy, but really now we're digging a lot deeper. We're hearing the needs of the patients, and then we're developing programs through JamesCare for Life. We're building other services within our department to really meet the needs of those patients.
Oh, that's interesting when you say you develop programs with JamesCare for Life, because you're in touch with the patients earlier. You know what their needs are. You then go to Julie and say, hey, this is what we need. And Julie says, okay, let me find some people.
Let's start a class.
Wow, what's an example of that when you did that?
Well, I'll give you an example just that I'm thinking about off the top of my head. One disease group in particular here, our breast cancer population, they utilized survivorship a lot at the end of treatment. So they weren't referring to us until a patient was done with treatment, and we would give them a document that's called a treatment summary and survivorship care plan. It's a long word, but it's a document that outlines their whole cancer journey. It would have variables on there, including the physicians that took care of them, their oncology history, dates of surgeries, path reports, chemotherapy, radiation, staging, genetic testing, followed by their follow-up, meaning what's next. They're done with treatment, so we're going to see them this often, and we're going to provide these tests. And then also the next section of that document really outlined healthy lifestyle recommendations. So now that they're done with treatment, what can they focus on? Diet, exercise, stress management, alcohol, and tobacco cessation. So in particular, this group of the breast docs decided, hey, we're going to send patients to survivorship at the end of treatment. You are going to provide them with this document called the Treatment Summary and Care Plan. And I'd like to add the COC, which is the Commission on Cancer, sets guidelines for us. And they said we should be offering patients this document. Well, we would see these patients, they would say, well, gosh, why didn't I meet you sooner? I wish I would have known that I had counseling options or fertility discussions or sexual health clinics that I could be a part of. So now we're kind of going back to the key players, the physicians within that group, to say, hey, maybe we revisit this and you start with survivorship at earlier on. And then we're also bringing that information to other cancer specialists here at the James to say, when is the right time to refer to cancer survivorship? Because there's a need at the beginning, the middle, and the end. There's a need throughout. So maybe it's like a consultative type of thing where we see patients throughout their whole journey to really help meet the needs at that time, because they'll change. What they need at day one is different than what they need at their last day of treatment.
Yeah, because as they go through treatment, their health and how they're feeling changes. But I'm guessing that having these discussions with patients earlier in their treatment really helps, like from an emotional, mental standpoint, that they realize, wow, the James offers all these things that I can take advantage of.
Yes.
And it just gives them some comfort. Do you find that?
Comfort for sure. Lots of my chart messages through treatment, right? Like, hey, Denise, I haven't talked to you, but this is what's going on. What would you recommend? So really, it's like a little bit of a liaison for them to help them navigate what's the best resource or intervention for them at that time based on their symptom that they're currently having.
Wow, so you're steering people towards JamesCare for Life, which is great. So, Julie, fill us in on, I mean, we could talk for hours. You have so many programs. Yes. I printed out five pages of programs, and I don't even think that was all of them. But sort of give us a little of the history and how you've grown, because you've grown tremendously.
Absolutely. So JamesCare for Life has been around for more than 20 years in some form or another. It's funny, I was recently looking at what was our first brochure. You mentioned the 5-page plus document that we have. Our first brochure had about 10 programs in a 3-month period, whereas now we're averaging over 30 a month.
Yeah, and but so, 20 years ago, that was a lot.
It was a lot. You're absolutely right.
Yeah.
And so as Denise mentioned, as guidelines have changed, recommendations have changed, we have been looking at how can we continue to meet the needs of cancer survivors and their families. In our department, we are developing programs that address the ways life is impacted by cancer diagnosis, right? Which is, we know, it can impact so many different factors of life, right? Physical health, side effects, emotional and coping, family relationships, family roles, finances. And so there's just so many different ways that cancer impacts both the cancer survivor and their family that we want to be able to support them as they're going through their experience.
Wow. So, and again, you have too many to mention, but why don't you give us an example or two?
Sure.
I'm putting you on the spot.
That's all right.
To pick your, not necessarily your favorites, but a couple. Maybe that have been around longer and there's some of your larger programs.
Sure. So we have education programs, and so that's where we can also tap into our experts here at the James as well, where we're working with our providers and clinical staff to provide education programs for our caregivers and patients. That could include specific cancer around updates in cancer treatments, or also how to manage lymphedema, how to manage certain side effects. We also offer nutrition programs, which I will say are very popular. We have 2 dietitians in our department who offer monthly educational programs, hands-on cooking demos, so you can actually get a little bit of experience in how to chop vegetables and looking at different ways that you can cook those vegetables. We also have a garden expert as well who works in collaboration with our dietitians and manages an 1.5-acre garden called the Garden of Hope, where patients and caregivers can come out to harvest over 100 varieties of vegetables and herbs each season.
I'm familiar with that and have taken advantage of that. And Talk a little more about that, because I don't think people know about it. It's amazing that James patients and their caregivers for, I think, 2 years get to go to this garden and get crops.
Yes. We call it the Garden of Hope, but it's really a farm when you think about the size of 1.5 acres. And so our garden expert, along with our dietitians, they are providing education. It is an educational garden. And so they're talking with individuals about what's kohlrabi, or what's a new way that you can cook a vegetable that maybe your family's already eating, but maybe cook it a little bit healthier, or try it in a different way, incorporating different herbs. And so families can come out and harvest one time a week throughout the season for up to 2 years, and have access to fresh veggies and herbs for their family.
Yeah, that's a great program, and both of you can talk about this. That always we should eat healthy, but I think for cancer patients, it's sort of a little bit of a shock that I've had cancer. What can I do to stay healthy? And exercise and nutrition are so important. So, Denise, are you finding that patients, once they're diagnosed and being treated, want to make changes to be healthier?
Yes, I actually think that happens the most at the end of treatment. A lot of times towards the beginning, they'll might ask a few questions about that, but they're really in game mode, right?
Yeah, they just want to get through it.
They're meeting, frequently with physicians and undergoing treatment and managing side effects of treatment. So we talk about it, but I would say the majority of that discussion is usually at the end of treatment, where they're really like making goals moving forward, healthy lifestyle recommendations and goals. So it could be something as simple as they want to start exercising and they haven't been exercising, or they don't eat vegetables but now they want to try to eat 1 to 2 servings. So I really try to make sure that they're attainable goals and really ask them where they're at this juncture. Do you eat any vegetables at all? Well, no. Well, then let's not start with 3 to 5 servings. Let's try to do 1 serving a day. And the great thing about all of our JamesCare for Life programs is they're free for patients, right? So there's a huge financial burden for these patients when I see them. And so I really try to gauge where they're at. Do they like group settings? Do they like individual settings? Do they have the resources for something one-on-one, or do they need to participate in a free service? So that's the best part, is that I know the services, my team knows the services, but we're really good at gauging what the needs are. Because, some people like to learn in a group, but some don't. Some are like the one-on-one setting.
Yeah. Now, one of the things I've learned from talking to patients and doctors is that cancer treatment is a very stressful, anxious time. So you both have programs to help people with sort of I'm going to call it the mental health side of it. So can you talk about some of those programs and why they're important?
Absolutely. Cancer can be isolating. It can feel really scary, overwhelming. There's a lot of shifts at home that can happen. And so we have educational classes that are focused on coping with cancer, coping during times of uncertainty. That can be helpful for individuals as they're managing their stress. We also offer a wide range of mindfulness programs, which can be very helpful in stress reduction, as well as support groups and one-on-one peer support as well. So that ability to be able to talk to somebody who's been through cancer or had a similar experience can be so impactful for someone when they're feeling isolated in their cancer experience.
Yeah, we've talked about that before on the podcast, that mindfulness and meditation are just that science and tests are showing how much it helps. So I'm all for those programs.
And I'd like to echo art and music therapy. I mean, so when a patient, and I'm doing, a screening, we do something called a supportive care screening when I'm seeing somebody. And really, we ask a lot of emotional questions. And what I find a lot is there's fear of reoccurrence, anxiety, body image concerns. And then based on that, we'll talk about some interventions that they could try. And it could be counseling. We have some psychologists. We have social workers that they could meet one-on-one. And we offer in-person visits, or they can be video. So there's not a lot of positive things about COVID, but one positive is now we're doing a lot of virtual classes with JamesCare for Life. We're doing a lot of virtual patient visits versus seeing them at the actual Martha Morehouse. They've been seeing so many physicians and have so many appointments. We're really trying to meet their needs, and we'll see them via video or in person, and then decide, did they want counseling? Is it something that they could try art or music for? Could they try one of our mindfulness classes? And then there's also 2 nurse practitioners who do medication management for cancer-related distress and anxiety. So I'll tell patients, I don't usually jump right to medication, but if you've tried some of these interventions and they aren't really working, maybe that's the next step. And so we'll have those discussions as well.
Just so I understand, you're talking about managing medicines to manage
Anxiety, depression,
okay.
Body image, coping. You know, people that are having a hard time getting out of bed because they're so depressed, dealing with a new cancer diagnosis, patients that aren't coping well with their family. So we try to do those mindfulness and those other interventions, but if sometimes it doesn't work, we will talk about an antidepressant or an anti-anxiety medication for them.
So you have a whole team of psychiatrists, social
We have
workers?
a psychiatrist, social worker, and 2 psychiatric nurse practitioners. That's all they do, is medication management for cancer-related distress.
As you're talking more and more about these programs, this is a small army of people that between the 2 of you are involved. Can you give us a sense of how many are involved in JamesCare for Life and your clinical programs?
Yeah.
Absolutely. So in our department, we have 9 positions that are putting all of the programs that we do together each month. So with over 30 programs a month, we have nine staff who are helping us facilitate those programs.
And how about on your side?
So I'm in my mind counting as you ask the question.
We can say approximate.
Yeah, I think we have 6 nurse practitioners, we have a psychiatrist, we have a physician, and then a lot of social workers. There's probably 6 or 7. We have an art therapist, we have a music therapist, we have a physical therapist, we have an occupational therapist. And I'm so sorry if I'm missing anybody. But
Now, your music therapist, Terrell, I forgot her last name, Terrell Jackson. She has been on the podcast. She's great.
Yeah.
And I went to one of her classes, and it was really fun.
Yeah.
So, and I've not been to an art therapy class, but that's got to be fun, too.
Yeah,
You
Ann
get to-
Harding. Ann Harding is our art therapist.
Yeah, that would be more of a video than a podcast. And you're always coming up with new things, but we're going to take a quick break, and when we come back, I want to hear about some of the new programs that you're creating.
You didn't choose cancer, but you can choose where to treat it.
And when you choose the James at Ohio State,
you're picking a team of experts who understand there is no routine cancer.
You're opting for care from a highly specialized team dedicated to treating one type of cancer, yours.
A team that studies the unique makeup of your disease to develop a personalized treatment plan.
You're choosing our region's only comprehensive cancer center designated by the National Cancer Institute.
Where more than 1,700 scientists are working on new treatments and new hope for every form of cancer.
At the James, you're making the choice to have the most advanced treatments, many of which were developed right here.
and you're choosing access to the James world-class clinical trials, dedicated support services, and an unmatched survivorship program to support your life after cancer treatment.
You didn't choose cancer, but the choice of where to treat it is clear.
We're back, and one thing I noticed when we talked in the first half is you two seem like a great team of collaborators. So how did that come about, and how does that help you improve what you do, and which again leads to better care for patients?
Absolutely.
So this is Julie first.
Yes. It's a natural collaboration, I would say, with clinical survivorship and JamesCare for Life. As patients are coming through her clinic and Denise and her team are identifying needs, our department is providing a wealth of programs every month that can help meet those needs too. So they're sending folks to us, and then likewise, we are also, as we're holding programs and talking to individuals about resources that are available, we're also sending them back to our counseling department, to our clinical survivorship team, so that patients really have a good idea of all of the opportunities for support they can receive here.
So you meet regularly to talk about this and say, what can we do to do a better job?
And then I would say, if I do meet a patient and there is something of clinical significance, I then relay that to their primary oncology team. So we try to make sure everybody's in the same loop about what's going on with these patients.
Oh, so that it's not just the doctors are in on it, the physicians are understand too, and collaborate with you.
Correct. Maybe they're having a side effect, some chronic neuropathy, and I try them on a medication. I really want to make sure the team's aware of that and that they know moving forward this is what we've tried, and I let them weigh in as well. So it's really a collaborative approach.
Okay. So that leads to new ideas, which lead to new programs. So fill us in. Maybe Denise, you'll start this time. What's something new, either that just started or something you're working on to start soon?
Yeah. I would like to talk a little bit about our Certified Child Life Specialist. That's one of our newest programs in the Cancer Support Group. And really, we were listening to these survivors, and they were telling us, we don't know how to tell our children that we have cancer. We don't know how to tell our grandchildren we have cancer. Or maybe our disease has progressed, and how do we really give them that information accurately based on their age? So we went back and we hired 2 Certified Child Life Specialists, one to support our inpatient population and one to support our outpatient population. And what they do is they are trained professionals with an expertise in helping children and their families cope with medical illness. We also have a new room on 14 James, and it's the Alexis Sunnyside Playroom, and it is set up as an area where interventions can be had with children with our child life specialist, and it's a space where these kids can go to kind of prepare them for maybe seeing their loved one.
Describe that space. Is it
very childlike, right? Lots of toys.
So it's like
colorful.
A indoor playground.
It's
almost.
An indoor play
so
area.
They feel
lots
comfortable.
Of craft. Yeah. We know that these kids have a lot of emotions, and we want to encourage them to talk about them. So the child life specialist will do things like memory making with their mother, father, grandmother, grandfather. They might do fingerprints, thumbprints. They might do a craft project together. They prepare the child for potentially what they could see. They use stuffed animals or play dolls to show them the tubes that might be their family member might have.
Wow, so they use these tools to help the kids understand in a way that's best for them. But it's just amazing that you don't think about it, but how cancer affects the immediate family and beyond, and especially kids. I mean, that's devastating. So.
And you find when you talk to these patients that they're more worried about their family than they're worried about themselves.
I'm sure particularly parents about their young kids, that's definitely on their mind. Wow, so that's a great new program. Say it again, it's a Certified Child
Life Specialist.
That's a great idea.
Yeah. In tandem to the clinical services that we're providing to families, we also offer family and parenting programs in our department as well. So again, that's another opportunity for us to collaborate with our experts here at the James. We have family programs that are held almost monthly and look at a variety of ways to help kids learn about cancer in a safe environment with age-appropriate language and a hands-on activities. Some of those can include equine therapy, paint class for families. We have a ceramic blessing bowls program where families can come together and create a ceramic bowl that they then can take home and to celebrate some of the work that they did together as a family.
I've heard a little about the equine therapy program, but I don't know much about it, and it sounds interesting. How and where do you do that?
We hold that at one of the OSU farms, and we, in collaboration with a community partner, there are horse specialists and equine therapy specialists who facilitate the program, and it's truly 2 or 3 horses and a pasture, and families learning different ways to interact with the horses, spend quality time together as a family, and that has also another opportunity for families to do something together that doesn't focus on cancer, which can be really important.
Yeah, to just get away from it. And
absolutely.
And that's what I'm always amazed at here at the James in Ohio State, the size and scope of the university and the resources that gives you. You have a farm where you can grow crops and a farm where you have horses that are available to cancer patients. You just don't find that at many places.
No. Right. We also, a newer program for us is Parenting Through Cancer, and that's really geared at parents, grandparents, adults who have been diagnosed with cancer, and how they're helping their children or children in their lives cope with cancer, how to talk about cancer, some tips for things to include, or things maybe how to phrase different words that can make it a little bit easier for children to understand.
I know a growing field is adult and young adolescent, AYA. Did I get that right?
Yes. Adolescent and young adult.
Adolescent and young adult. I'm sorry. Same thing. I know that's a growing area, and that the James is really working to build programs in that, and that sounds like that's right in your ballpark. So fill us in on what you're doing in that area.
Yeah. So we know those patients diagnosed with cancer between the ages of 18 and 39 have a unique set of needs. They are young. They are usually finagling family, work, and a new diagnosis. So
college.
College, yeah, absolutely. So we have a social worker who really specializes in helping those patients and developing a relationship with them early onset of diagnosis and then throughout their treatment. She uses a lot of the resources through JamesCare for Life to help support these patients, but also a lot of external community programs as well.
Okay.
Yeah.
And Julie, what can you add to that?
Yeah, from a programmatic perspective, really the intervention for young adults here at the James is being able to talk to another young adult who's been diagnosed with cancer. Somebody who maybe is 25 and coming to an adult cancer hospital, they still may be the youngest person in the waiting room by 30 years, 40 years. And that can just be tremendously isolating for them as they're trying to navigate school, life, starting a job, all of those major transitions that happen in our 20s and 30s. And so we offer these hands-on programs where young adults can come together and see that there are other people who are experiencing something similar, and then also adding in, I would say, an enjoyable activity. So we've had game nights, we've done equine therapy with our young adults, paint nights at our garden space, and so a wide range of opportunities for folks to come together and learn about a healthy lifestyle and also spend time with other young adults who've been diagnosed with cancer.
Wow, we've covered a lot of ground, and there's even more ground to cover, but I think it's important that people should know who are patients and, well, I don't want to say former patients, because once you're a patient for life. So how can people learn more about JamesCare for Life programs and become part of them?
Absolutely. So you can visit our website, cancer.osu.edu/JCFL, for JamesCare for Life. And you can...
I've noticed, if you just Google JamesCare for Life, you'll find it too.
You'll find us, absolutely. And it will lead you to a page that outlines the different categories of programs that we offer, upcoming events, and how to register. Of course, individuals can also reach us by phone as well to connect with us.
Who is eligible to be part of JamesCare for Life programs?
Any cancer survivor or caregiver in the community, regardless of where services have been received.
Yeah, that's the key. You don't have to have been treated here. If you live here and are a cancer patient, you can be part of these services.
That's correct. And I will say that, again, one of the positive things that came out of COVID is that we also have virtual programs.
Yeah.
So that really opens up and makes programs more accessible for individuals who are not living in Central Ohio or who are not able to travel here for whatever reason. We do have online programs as well.
So Denise, for people who are currently being treated, who are more on the clinical side, how can they connect with you and your team?
Yeah. First, they can ask their care team, their clinical care team here at the James, but also patients are able to self-refer themselves. So they can call our number, which is 366-8700.
Say that again.
366-8700.
Okay.
And just ask for a survivorship visit. And they will meet with a certified nurse practitioner to kind of go over all of their supportive care needs.
Oh, so that one person will come in and that nurse practitioner will fill them in on what's available.
Yeah.
And if that person says, hey, I want to do this, that nurse practitioner will make sure they're part of that.
Yeah. We do something called a supportive care screen that really breaks down how patients are doing physically, mentally, emotionally, spiritually, and then also financially. So there's a pretty detailed questionnaire that we have patients fill out, and then we base those answers on interventions and referrals and classes. And
so you're very proactive, and you're going to make sure people know what your team does.
We almost ask too many questions.
Okay. Well, I have one more.
Oh, okay.
What motivated each of you? You didn't start off doing this. What motivated each of you to become specialists in survivorship? And I'm going to ask Julie to go first.
Sure. Cancer impacts all of us, right? We all know someone who has been diagnosed or will be diagnosed with cancer. And so it has been an honor to work alongside folks during one of the most difficult times of their life. Really, my goal in my position and within our department is to look at different ways that we can engage in sharing information, knowledge, resources, and help empower people as they're trying to make decisions for themselves and their families. And I think that is just such a wonderful opportunity to be a part of. It's a meaningful experience for me. And I often say, we learn as much from our patients and families as they learn from us.
Yeah, that's true. Yeah. And Denise, how about you?
I agree with everything Julie said. But, a little bit about my background. I went to Ohio State, and my first job was a student nurse at the old James. And I've been here 24 years. So I was a student nurse, a nurse in the float pool, a nurse practitioner in surgical oncology, and then my most recent role in survivorship. And really, I had the interest in just helping support patients. So I was the one who helped them through surgery originally, but really kind of was sitting there thinking, what more can we do? And when you're in those busy clinics, you don't ask patients how they're coping. You don't ask how they're eating. Are you exercising? You don't have enough time. You're clearing people for chemotherapy. You're getting them ready for surgery. You're pulling drains. So that's kind of when the evolution of survivorship was coming about, and I really wanted to be a part of that.
So it sounds like you're both a bit of pioneers in this field, and also seems to me, I would ask you what qualities you should have, but you'll be modest. So I'm going to say empathy and caring about people seems to be the thread that you and all the members of your teams have.
And I would say very flexible and moldable.
Yeah.
Because we're constantly growing. It's not a traditional clinic where you come in and it's running and it stays running kind of that way. We're always adding new programs. We're always looking at needs and changing and growing it. So it has to be somebody who really is flexible and moldable.
That sounds like you two. Well, thank you both for all the programs that you offer and for sharing them with us and for being on the podcast.
Thank you so much for having us.
This podcast is brought to you by the Ohio State University Comprehensive Cancer Center, Arthur G. James Cancer Hospital, and Richard J. Solove Research Institute. For more information, check out our website, cancer.osu.edu.